What's up guys, it's Dr. Tom, Australian osteopath here, and today we are looking all at tennis elbow. So tennis elbow can cause pain and tenderness on the outside of the elbow. And no, as the name suggests, it is not limited to tennis players. So tennis elbow is generally an overuse injury. And when we talk about overuse, it's overuse of the motion of wrist extension and finger extension. And all of these muscles here, the forearm extensors, lead back into that, what we talked about before, the lateral epicondyle. And where it attaches to on the side of the humerus here, when we're overloading, we can start to develop little tears, and that's what causes either the local pain when you're touching or the pain when you extend the wrist and extend the fingers. So common causes of tennis elbow are doing repetitive tasks. So this can be things such as typing, hammering, painting, also sports. So sports that require a lot of wrist movement. And this can include things such as tennis, racquetball. And lastly, you see this a lot in manual labor where they're overloading these tendons. So things such as carpentry, plumbing. If you're unsure whether you have tennis elbow or not, the main symptoms of tennis elbow is number one, pain on the outside of the elbow. And this can be pain when you're trying to activate it. It can be a burning pain, a sharp pain. Another symptom of tennis elbow can be weak grip strength. And a lot of people, this can be trying to open jars, and turning a door handle can be really painful. If you're someone that is not sure whether it could be tennis elbow or whether it could be something else, an easy test for this is to make a fist, have the fist off the side of a table, let the fist drop, and then from here, actively try and lift the wrist. So if you're lifting the wrist and there's pain going into this outside area of the elbow, there's a solid chance that this could be tennis elbow. The other one is straighten the fingers out, keep things flexed, and then try to, with the middle finger, so the third finger, try to extend that finger. And if you feel it go all the way back into that lateral epicondyle, the outside part of the elbow, there's a solid chance that that is tennis elbow and that this routine may be very beneficial for you. Okay guys, so let's not waste any more time. Get into the best exercises and things to do if you have tennis elbow or lateral epicondylitis. In this acute phase where things are really inflamed, the tendon isn't happy, sometimes people come and lifting a cup of coffee can even cause pain through the area, opening doors. When it's at its worst stage, what we want to do is get rid of the inflammation. And the best way to do this is using ice. Okay, so with ice, we want to do 15 minutes of ice 3 times a day. And this is a minimum, but especially after doing tasks where you felt the pain, you know there's going to be inflammatory markers coming into the area, ice is going to really help. So a compression sleeve as well can help a little bit with the inflammation. And lastly, an elbow brace. So if you're someone that has a job that requires a lot of manual work, a lot of movement in the wrist, you can get these little elbow braces. They're little straps that go around. And these straps are designed to put pressure down on the extensor tendons, which takes pressure out of where it goes up and attaches to. Then we move on to phase number 2. So phase number 2 are where the little tears in the tendon start to attach and reconnect. But the way they reconnect, it's a shortened and almost scar tissue form where it doesn't allow proper lengthening of that tendon. So in this phase, the main purpose and the main thing we want to do is start to stretch the tendon. But my number one rule with this is we want to make sure there is no pain. Okay guys, so stretch number 1 is very basic, very easy to achieve. We are going to lock this elbow straight and we're going to actively pull, using the other hand, our wrist into flexion. So with this one, if you pull and you start to feel pain, we don't want to go to the area that we feel pain. We want to go up to that barrier, but not through it. So as we keep this elbow straight, we're pulling this wrist into flexion and we're holding this for 20 to 30 seconds. My biggest thing here is use your breath. A lot of people who do this do not use their breath. The exhale controls everything in terms of releasing muscle rigidity. So breath in through the nose, out through the mouth, and let yourself sink deeper and deeper into that stretch. So after the 20 to 30 seconds, have a little rest and do a second round with this. Okay, and now stretch number 2. With this stretch here, the second stretch, we are going to place the injured side into internal rotation. With the other arm, we reach around the side, and we're going to use this left arm, keeping the elbow locked straight, to internally rotate that straightened elbow even more. Once we're in position there, we're going to hold this for 30 seconds using the breath. So in through the nose. As you breathe out through the mouth, try and relax all those little tight spots, feeding up into the area as much as possible. And let the stretch increase, ensuring that there is no pain. So after the 20 to 30 seconds, we can come out, we can have a little 15-20 second rest, and then we go back in, internal rotation, grab around, increase that twist. Both these stretches here, you can do this twice a day. So I often suggest not first thing out of bed. Let the blood flow and let things warm up in the morning. So maybe 2 hours into your day, start the stretches, and then again right before you go to bed. In this phase as well, I really find it beneficial, and I've had a lot of patients have really good results with using a lacrosse ball or either a tennis ball. You can put duct tape on the tennis ball to make it a little bit more firmer. You can use a golf ball. Golf balls can be pretty aggressive and a little too painful, but I find the best thing in a lacrosse ball. I'll leave a link in the description section below, so feel free to click on that and purchase one if you want. We can put this on it. I often find a soft surface is the best. Forearm here, arm over the top for a little bit of extra pressure. Find those sore spots, so really slowly moving across the tendons, find the sore spot. And once you find the sore spot, we're going to hold it there and go 20 tiny little rolls, nice and slowly over the sore spot. Use your breath, try and relax. We don't want to be tensing up. It's not going to get you anywhere. So even if this is like an 8 or 9 out of 10 in terms of tenderness, try and use your breath. And by the end of those 20 little micro rolls over the area, we should be able to get that 8 or 9 out of 10 down to a 2 or 3. So once you get it down to that 2 or 3, then it's searching for another little sore spot, making sure you don't go too high into the inflamed part of the tendon. And I'm on another one. So find that other sore spot and then keep going in. If this isn't enough pressure, you can stand up and you can put more pressure directly down onto it, which works really good. Keep this arm nice and relaxed. Okay guys, so in this phase 2 as well, I really like patients to self-massage, and you can use a really basic anti-inflammatory cream. I love Physio Cream. Put a little bit of cream on the opposite hand, go just below that area, so as the tendons feed through down to almost the fleshier part of the muscle belly. So what you're gonna do is come off the sore spot here and just go down the forearm and use the thumb. Work straight down, follow those sore tendons. Remember, this shouldn't be too painful. So if you're here and you're whining and making faces on the table, you're pushing too much. Another secret tip, we can do the self-massage, and then you can also use a little fascial blade. Same thing as before, you put the cream in that same area, and all we're doing here, making a fist, slowly dropping that wrist into flexion while we're working up here. So 2 things to focus on at once, and bringing the wrist all the way up into extension, ensuring that there's no pain. So slowly dropping, and you can see here, I am just working it really lightly through these parts here, which is going to really help. So you can see it should be resting on a surface. I'm just doing this to show you guys. So little fascial blade, look down in the description. I'll leave it there, one of the plastic ones that are a little cheaper than this guy, that you guys can look at getting if you really want. Then we move on to phase number 3. Phase number 3 is strengthening of the tendon. So we've started to get the fibers of the tendon moving properly. They're not all compact. So now we want to load the tendon. So if you can do, we'll get into the exercise in a second, but isometric strength often comes first, followed by eccentric strengthening exercises. And eccentric strengthening exercises is allowing, you'll see when we get into this, it's the release phase and getting a control of the release phase. And then lastly, then we go into our concentric and eccentric strength, which is shortening the muscle and strengthening into a lengthening position as well. What I want you to do is focus on the down phase, so the release phase. So we're gonna slowly drop that wrist into flexion, but I don't want you just yet to be lifting yourself. You're gonna bring the other hand in, lift it up, anchor the elbow down, and then slowly drop it down over 6 to 7 seconds. So keep that really slow, really controlled, using the other hand to come in, bring it back up, and then slowly drop again. So if this weight feels too easy, you can jump up a little bit, but as long as, once again, you're not feeling any pain, you're not letting that weight drop too quick. So when you know the weight's too heavy, you're gonna be sort of shaking, dropping. It's not gonna be a smooth motion. We don't want that, because that can pull a little too hard into where the tendon is still healing. So lifting up from there. I like to go 2 lots of 10 reps here, but just make sure you keep this as slow and controlled as possible. So once you've done at least 2 weeks of this and there's no pain, then we can go into the concentric phase as well. So the concentric phase is locking the elbow down, starting in flexion, squeezing that wrist all the way up, and then slowly dropping it down. This should be a slow, smooth motion. Nothing about it should be fast. So the same thing here, once we go into the concentric and eccentric contractions, we're gonna be doing 2 lots of 10 reps with these daily as well. All right guys, so for this next one, what we're doing, straight arm, getting as much external as possible, and then coming internal. So just trying to get free that forearm up. 2 lots of 10 as well, 2 lots of 10 with everything. Okay, so another strength one we're doing today. We can use a towel. We're gonna roll this towel up, and then from here, I want you to try and twizzle it. So keeping the elbow straight, you're gonna try and go one way, hold for 5 seconds, and then slowly release just a little bit. Give yourself maybe 3 seconds out there, and then go back in. Try and really keeping the elbow straight, squeeze, 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 and then slowly back from there. So we're gonna just do 7 on one side here, and after the 7, always do on the other side as well. So then you go back the other way, and squeezing back. And after 5 seconds, little 3-second release. The last exercise for today through this strengthening phase is using TheraBand putty. If you don't have TheraBand putty, elastic bands work great. And you can, if one isn't enough, you can double them up, use 2. I'll show a picture here so you can get an idea and do this. Wrist overhangs over the edge, and then from here, as we squeeze the wrist up, we're trying to spread the fingers as much as possible. So it's wrist extension and finger expansion. So spreading those fingers as much as possible. So you'll see here, I'm gonna do it side on. Wrist overhanging, coming back, spreading the fingers, holding for 5 seconds, and then slowly dropping down, letting the fingers come back together. Go 2 lots of 7, and just like that. So for a lower grade tendon strain, we can be looking at 6 weeks until this is fully resolved. However, if this is advanced, and if you're continuing to use it at work and re-aggravate things in there, it can be actually 3 to 4 months until things are fully resolved. So these stages here may need to change depending on how quickly your healing time is, how bad the initial injury was. Okay guys, so I hope you enjoyed today. Remember to write in the comment section if you have any questions or if there's any videos you want to see in the future, and enjoy. I really hope this has helped you guys.